Hi, everybody. Thanks for joining us. My name is Johanna Henderson. I'm a communications specialist here at BC Healthy Communities. I'm joining you here today from beautiful Victoria in the southwest corner of the province, which is, of course, on the unceded territories of the Songhees, Esquimalt, and WSÁNEĆ nations. And here at BCHC, when we do that territorial acknowledgement, it's a bit of a prompt for us to be reflective about the nature of our work and the kind of colonial roots of the fields that we work in, including planning and public health, and even for me in communications. I use those acknowledgements as a prompt to think about how colonialism is kind of embedded in the practice of my work and how I can continually challenge myself and shift my practice as I learn from that kind of feedback I get, my own learnings and the practices of others. So I see there are folks continuing to join, and I will just do a bunch of our front matter for this webinar. How can local governments build equity into community engagement processes? I'll continue to kind of do a little bit of housekeeping and chat with you. But I think like now that I have started with that territorial acknowledgement, and we have some people joining us from other parts of the province, as presenters, and they'll be doing acknowledgements for where they're from as they arrive. But I think it's a good time to get you all to introduce yourself. So if you look, there should be a chat option, and we'll kind of get familiar with the Zoom interface this way. For most of you, it'll be on the right-hand side in a panel. I see some people are already using it. Excellent. So I'd love it if everybody could just take a second to click on the chat box, type in your name, and if you know the territories that you're joining us from. Hi, Greg. That's great, thanks. I love to get a sense of kind of who is here. Ingrid, Carolyn. Hi, Rebecca. Nice. Oh, look at that. Grand Cache. Oh, sweet. I love this. That's so excellent how many people are familiar with the territories they're in. Hi, Glennis. Hello, Allison. Our board member Allison is here. Hi, Christine. Okay, that's good. So it actually seems like a lot. Hey, Sharito. It seems like a lot of people have figured out how to use the chat, and that's exciting. I know it can be a little bit unfamiliar. Oh, Naomi. Naomi, I'm from Charlie Lake, just outside of Fort St. John. So nice to have you here. Hi, Sammy. I'm going to just say hi to people all day. Okay. So while people are continuing to say hello, let's do a little bit more housekeeping. For those of you who are using Zoom for the first time, we can do a little quick tour. The first thing I would say off the bat about Zoom is if you're joining us via the web app, if you're able, I would really encourage you to download the desktop app and join us that way. The web app works fine. So if you have IT policies that prevent you from downloading stuff, that's fine. But there is just a little bit of limited functionality in terms of the polls. You can't do the polls. So yeah, you'll still be able to see the webinar no problem, but you won't be able to participate in the polls. So we still got people saying hello. Hi, Leslie in Calgary. This is awesome. Thanks so much, guys. Let's see. Now we can take a little tour of the Zoom interface. So for some people, it'll be at the top of the screen, and for others, it'll be at the bottom of the screen, but there is a menu. And you will see there's a chat box, of course, which many of you have found and are using, and that's excellent. And so during this webinar, our operations specialist, Claudia, our researcher, Jacob, and our healthy community planner, Emily, will also be in the chat. So if there's a bit of a conversation going on, they may be chiming in, and that's great. We encourage that. And then if you have specific questions for panelists, there's also in kind of the left-hand side of the menu there is a little square that says Q&A. That's where you would enter your questions, and we'll look at them at the end and we'll do questions. But I just think it's great to know that that's there, because if you have a question in the moment and you think you might forget it by the end, you can definitely pop into that Q&A box and you can enter your questions so you don't forget it. There's also an option there to enter questions anonymously, so that's available to you. And then also outside of this webinar platform, if you like to follow along on social media or you like to kind of tweet what you're learning, you can use the hashtag equitable engagement. Our communications coordinator, Catherine, is in the other room, and she will be live tweeting kind of some of our favorite moments of this webinar as we go along. So you can also use that later as a bit of an archive of some of the top moments of this webinar. And then just a reminder that today's session is being recorded and it'll be up on our YouTube channel a few hours after we finish up here. So if you can think of anyone on your team or another colleague who's not here today but could benefit from seeing this, we can send a follow-up email at the end of this with a link to that recording so that you can pass it on. Ooh, okay. So let's spend just a couple minutes talking about BCHC and our Plan H program. Let's see. So for those of you who aren't familiar with BCHC, we're a province-wide not-for-profit that facilitates the ongoing development of healthy, thriving, and resilient communities. And we believe that it's possible, but not just possible, it's necessary to create communities where it's easy for citizens to be healthy and well. And we believe that by making those choices with community members' health in mind, we can move towards economic, environmental, and social sustainability. And that's why we do this work. So we're a team of planners, public health and evaluation specialists, community engagement practitioners, and researchers, kind of operating at the intersection of planning and public health, which gives us a pretty unique vantage point. And I'm sure different people here who are joining us have different sections of that lens as well. And we do things like distribute grant funding, provide resources and program funded supports, as well as working directly with and for communities through partnerships and fee-for-service relationships. And this webinar itself is part of Plan H, one of our programs, our largest program. And the Plan H program supports local government engagement and partnerships across sectors for creating healthier communities. Working together with health authorities and the Ministry of Health, Plan H supports the province's health promotion strategy. So yeah, I mean, that's enough for me today. So, oh, this was one thing actually. So this webinar is supporting our launch of our Healthy Community Engagement Action Guide, which is something, another Plan H initiative. So this is the cover of it. And we will get Catherine to put in the chat the link to download it. But if you want to look at, there's Catherine right there, planh.ca/engagement guide. Beautiful. So yeah, you can have a look at that afterwards. I have a list here of kind of the different things that it features, but lots of actions and examples from Canadian communities doing amazing things in terms of community engagement. All right. So first off, I'm going to hand it off to Claire Sauvage-Moore. She is our Grants Engagement Coordinator here at BC Healthy Communities, and she's going to talk a little bit about equitable engagement and using an equity lens. Next, after that, we're going to hear from Katrina Landbauer and Katie Hunter from Interior Health, and they're going to talk about some of those benefits of equitable engagement, both to individual citizens and to communities and local governments. And then they're going to identify some promising practices in BC that they've seen in their health region. And then finally, we're going to finish up with Patrick Ward, who's joining us today from the township of Langley. They have just done a very comprehensive social sustainability plan, and they're doing kind of an engagement process right now. So he's going to go through that as a case study for us. All right. I'm going to hand it off to Claire now. Thanks, everybody, again for joining.
Hi, if someone could just confirm that they can hear me by typing in the chat box. I just want to double check that the meeting didn't crash on me while I'm starting. Okay, thanks Glennis. Thanks guys. Back to my slides. Awesome. Once I can find them. Here we go. Okay, so hi everyone. My name is Claire Sauvage-Mar. I'm a recent addition to the BC Healthy Communities team as the Grants and Engagement Coordinator. And I'm very excited to be speaking to you guys today on how local governments can build equity into their community engagement processes. There's so much that we could talk about around this topic. BC Healthy Communities has learned some really interesting things over the years through our work in advancing health equity in communities. And we don't have all the answers, but from an equity point of view, that's really the point, knowing the limits of our own understandings and perspectives and lifting up the voices of others. So the first thing I'm going to do is be a bit provocative with this, well, not this one, but this statement. Most public engagement is worse than worthless. Ruben Anderson, the author of this article, is a sustainability consultant here in Victoria. Oh, sorry. 1 second, folks. I want to make sure that you can see my slides. All right. Sorry, guys. This is my first webinar with BC Healthy Community, so I'm getting used to this. Thanks, Joe.
Beautiful.
All right. So here, worse than worthless. This article by Ruben Anderson starts off with this pretty provocative statement. Ruben is a sustainability consultant here in Victoria. He writes pretty frequently for Strong Towns and used to work in Metro Vancouver. And the gist of this article is that whatever the mandate of a community engagement process is, expectations and timelines need to be rooted in reality. We often embark on these engagement processes without necessarily thinking through what we're trying to accomplish, and either intentionally or unintentionally, this makes people think that their input is going to be used more than it actually is, and that can often result in damaged results and damaged relationships with the public. So Johanna has shared a link to the article in the chat box. And if you get a chance to read this, you'll see that Ruben writes that if we are going to do good with our consultations rather than harm, we need to understand behavior, relationships, and expertise a lot better. And again, if there's a discrepancy between our promise to the public and what we're actually able to deliver as planning and community engagement staff, we end up leaving people feeling disrespected as though their time and energy has been wasted. Here's the new equity guide from the American Planning Association, which is another great resource that we're going to link to in the chat box in a second. And in this guide, there's a really interesting preamble called Historical Context, which acknowledges the role that planners, and I would also include engagement folks in this as well, it acknowledges the role that these folks have traditionally played in creating and perpetuating discriminatory practices against equity-seeking communities. And a really great example of this is zoning, which, as we know, is intended to separate incompatible land use, but it's also been used to exclude certain people from neighborhoods that have better access to jobs, to transit, and other amenities. I myself used to live in Baltimore, and in that city, a lot of the main north-south thoroughfares will have different names in more affluent neighborhoods compared to the rest of the city. And I do remember being pretty shocked when I learned that this was the legacy of racist measures that barred blacks and whites from living on the same block, with housing developments for different races being set up in really strict delineations. And this honestly hasn't changed much since 1910, and the city of Baltimore is still really grappling with this today. So the point is that planners and those of us who work with planners need to recognize that we are part of a system that, while it's improving, has historically been designed to predominantly benefit certain groups, often to the detriment of other groups. So with that in mind, let's take a minute to look at what the actual legislated requirements are for local governments in terms of public engagement here in BC. And what we see if we look at legislative evolution is that authority and responsibility in this regard has increased, especially since 2004 with the enactment of the community charter. All the same, most of what the requirements really acknowledge is the need to hold public hearings, and there's nothing really legislated beyond that. So when we look at what's prescribed here, it's really in the inform and consult categories that are frequently associated with the spectrum developed by IAP2. So that's the International Association for Public Participation. And I'm going to be showing that spectrum in a second. But right now, I think we're going to be running a quick poll. So I'd like to ask people to respond in the chat box. Who here watching has been able to take the IAP2 training?
Oh, I didn't make this poll. Can we just respond in the chat box?
So if you have a chance to go to the chat box, I'll just share right here. Just pop in if you've been able to join. Not me. Yes, I have. Okay. Glenna says it was great. Great lyrics. Yeah, excellent. So there is one coming up at the end of this month happening in Vancouver. They're happening frequently. Some of our staff are attending in a couple of weeks, so definitely check it out if you get the chance to. So it's great that some people are familiar with the IAP2 training. If not, this is a really great takeaway on my next slide. There we go. So this is the spectrum that I was just referring to, and this is found in our action guide on healthy community engagement right on page 2. And the idea that IAP2 is trying to advance here is that the more of the stuff to the right of the spectrum towards empowerment, towards true self-determination for participants, the better your process is. So in an ideal world, that area to the right is where engagement can build and build on the capacity and ingenuity of communities that we're engaging. But this isn't to say that there isn't a place for the stuff that's on the left. Sometimes continuums can kind of imply that there's a good side and a bad side. But for example, consultation can be really effective in terms of maximizing the inflow of information from a community to a local government. So there is a place for it, but it's imperative to be clear from the start. So again, returning to that article at the beginning, it's just a reminder that what we need to avoid is engaging communities in a way that leaves them with the impression that their input is going to be super fundamental to the final decision that's going to be made, when really all that we as the planner or engagement staff have license to do is really inform or consult. So as I said about that article before, it's just this discrepancy that needs to be avoided by properly and patiently managing expectations. And I'm sure that a lot of people here have some exciting or horrible stories about this type of top-down, really impatient approach, which hasn't resulted in lasting change. So you can email me later. My email is on the end of the slides. I'd love to hear some of your guys' war stories, but I think if we open that up to the chat, it might take a while to get through those. So moving on, if I can get my slides to cooperate. I'd like to bring in a metaphor of what's going on here, and it's this idea of a table, which some of you guys may have heard before. Oftentimes we talk about engagement as inviting people to have a seat at a table, but the problem is that it's a table that we've set out for them. So what this means is that it's my table that I'm inviting people to come to during an engagement process. I, as the professional in the leadership role, it's not a table that we've built together. It's not a table that we've set together according to expectations that we've decided on collectively. So this is a big idea that we do need to keep in mind as we do our work. Understanding, again, that if we can only invite people to this kind of preset table, we just need to set expectations accordingly at the beginning of the process, and then at the same time, stretch and reach and find ways to invite folks to build a better table together in future engagement exercises. And here's a nice quote just reminding us that inclusion is making a new space a better space for everyone. So now is a great time to talk about equity and using an equity lens. Very simply, equity is defined as leveling out access to opportunities, power, resources, and so forth. And there are a number of different graphics that have been used throughout the years to illustrate this concept and to differentiate it from the idea of equality. This one's pretty intuitive, I think. The idea that it's trying to get across is that thinking that the same approach will work universally is like expecting everyone to be able to ride the same bike. The problem with this graphic and with most equity graphics out there is that it can kind of imply that equity is actually a need to correct something, to correct an issue that's inherent to the people themselves, that these people all have different bodies that need to be accommodated into a system. So if we want to use this graphic as a metaphor for societal inequities, it's actually less accurate. The problem is actually society's uneven distribution of opportunities. So maybe a 2.0 version of this graphic would be to portray the ground underneath people's feet and under their wheels as being uneven. To imagine there being potholes around there or bumps or speed bumps, and it's actually something that's more structural. So that's just to get you thinking about how we can refine our understanding of equity even further. So in public health, a frame that's used for thinking about these inequities are the social determinants of health. And I'm sure that many of you guys are familiar with this already, and Katie and Katrina will be going into this shortly. But to put it really briefly, lifestyle choices determine a surprisingly small amount of our health outcomes. And about 60% of our outcomes, our health outcomes in life, are actually determined by external factors, including some of these things listed on this slide. And one thing that we like to do as an organization is to flip these. And this is to remind ourselves that it's actually, again, systemic discrimination, which results in health inequities. So on this slide, what we've done is flip some of these determinants just to get you thinking in that way. So it's not your gender which determines your health, but it's rather sexism that determines your health or can contribute to health inequities. It's not your race or your status, but racism in society, which can result in health equity. So this is building on that slide before with the bicycles. We're trying to move away from labels that are based on description towards more active terms, which recognize experiences of groups and individuals. And this has been a major shift in the thinking that I bring to this. And I'm attempting to make these adjustments in how I conceptualize equity-seeking groups. And it's been interesting to kind of take the temperature on how that's changing with the language I'm using. So I encourage you to try and incorporate some of these into your own practice as well. All right, so what is an equity lens? Well, it's taking all of those concepts that I've just blown through in the last couple of slides and considering them early, considering them often, and keeping them consistent throughout our planning process and engagement process. It's identifying systemic barriers that are common to the traditional engagement process, and it's addressing how and striving to reduce those barriers. And finally, it's really important that we consider these questions: who benefits from the impact of a given decision and who is negatively impacted? If you have to take away one thing from the slide, it's those two questions down there. And to remember who's missing. We need to consider who's not at the table. And as I mentioned earlier on that social determinants of health slide, where we flipped the determinant to reflect a systemic issue, it's also important to try and refine our thinking on how structural power imbalances might impact the way that individuals engage with their community and how those communities engage with government. And a metaphor that I like, but unfortunately I cannot find where I read this thing, but it's this asker's clock versus a teller's clock. If I do find it, I will let you guys know somehow. But the idea here is that there are two clocks during an engagement process. The first is their asker's clock. So that's the person doing the engagement. And then there's the teller's clock, which is the person who is being engaged. And the idea is that not everyone has the same timeline. Your engagement process might last 2 weeks. It could last 2 years, but the community is going to be there long after you're gone. So the point is we need to consider how we can avoid missing those perspectives of people who will be in the community long term and who may be most impacted by the final decision long after we're gone. So one more idea I'm going to be throwing at you is the scaling of engagement efforts according to proportionate universalism. So very briefly, proportionate universalism reflects the different, it reflects that different approaches and resources need to be applied to different groups based on the particular structural disadvantages that they face. So my question to you is, what if we put $100 towards engaging every person that's on this side of the health and social gradient, and put $1 towards the people that are up here? One example from our own organization, BC Healthy Communities, was in Strathcona. And in this case, we needed more responses to surveys from Indigenous and Aboriginal families. So our staff went to an Aboriginal childcare center and stayed there and waited to meet with families to help them fill out the surveys, to answer their questions, hear their qualitative responses as well. So it was a lot more resource intensive, more expensive, more time consuming, but extremely valuable. And here are 3 key parts of what it looks like to keep equity at the heart of our engagement process. So first, it should be reflective. We need to be asking those questions about who's accessing these engagement sessions, who isn't, why. We need to consider the authenticity of our process. So this would surround our motivation and our genuineness. It's our job as community engagement staff to get to know the people that we seek to engage. So have we done our homework on them? Have we considered hiring organizers from within the targeted community? Are we engaging in tokenism if we decide to do that? There's a lot of, again, reflection in this piece as well. And finally, transparency. So to be clear, once more, to be clear upfront about what we can and can't do as a result of this engagement. One of my favorite quotes these days is that progress moves at the speed of trust, and transparency and following through on what we say we're going to do seems to be really helpful in building trust with people. So just keep that in mind. Transparency is crucial. All right, so wrapping up, I'll return to this idea of the table, that we need to build one together with the communities that we are hoping to engage. And as I said at the beginning, we're not the experts. I'm certainly not an expert. And we do realize that there are a lot of challenges in shifting community engagement work to include an equity lens in the practice. Some of the challenges are that while there's an increase in use of health equity indicators, it's still insufficient. We're still developing methods of evaluating interventions on health equity, and we're still finding clarity of concepts and terminology, as I alluded to before. Community engagement is not easy work, but it's very important work. And that's because inequity really affects every community member. So while we may not be able to eliminate power dynamics entirely and get rid of structural barriers, there's still lots we can do starting today, beginning with incorporating some of this theoretical stuff into our daily practice and into our communication as well. Local governments are, of course, in a very special position to at least mitigate the effects of inequity, if not working to actively promote equity so that we can create healthy communities for all. So thanks very much for listening. I know that was pretty dense and that there are 2 more presentations, so I'm just going to say goodbye and pass it back over to Joe now. Thanks.
Do you want to show your slide?
Oh yeah. If anybody would like to get in touch with me later, here's my email address. Thanks.
Thanks, Claire. If you guys haven't figured it out by now, Claire and I are actually sitting right next to each other. We can kind of touch elbows here. Um, so that's what's going on with the peanut gallery in the background occasionally. Okay, I'm going to try to do two things at once here. I'm gonna share my screen. Okay, so one more thing that we just wanted to talk about a little bit, but isn't kind of quite within the vein of what Claire was talking about, is actually this notion of context experts. So this is something, when we were preparing this webinar, we had our researcher, Jacob, do a lot of looking into kind of leading practices, because it's also useful for us too, because we continue to work in community engagement just to see the way that people are framing things. And we found this really remarkable and helpful. The notion of context experts, and this is Lisa Adigale, who came up with this term. So we often talk about content experts in our work, and we can see because that's the word that my mouth wants to say. And the planners, the engineers, but what if we elevated those with lived experience and acknowledged their unique expertise, like brought them on before we even get to that engagement piece, and created a new table with everybody, as Claire says, at that kind of formative point in the process? It's not always possible, but it's something to think about. And one recent example of this that we talked about here at BCHC is Victoria's new Community Wellness and Peer Informed Task Force. So this is a task force that actually applications just closed on Friday. This is to address the mental health and addictions challenges in Victoria that we're all facing. And the people who were encouraged to apply to this were folks with lived experience with mental health issues, substance use that's problematic for them, experience navigating the mental health care system or addiction system, or experience with homelessness. So we thought that was really interesting and encouraging, and kind of an example of bringing people to that table as context experts before we even get to that point of community engagement on a decision to be made. And of course, it's an interesting example, but it's not perfect. There's always more that can be done. There could have been an easier application process, lower commitment opportunities, so people who were struggling with other issues in their lives wouldn't have to commit to this ongoing thing to be a part of it. Not clear what level of compensation there was for this work, because just an honoraria was mentioned, but it's a movement forward. And maybe that's a good point to kind of end from BCHC on, is that, at this point, we all know that what we're doing right now isn't really moving towards equity so much as we're just starting to mitigate some pretty significant inequities that are baked into our system. And that doesn't mean that it's wrong. It just means that there's a long ways to go, and it's great that we're all here and talking about it and learning from each other. Okay, I'm just gonna throw a poll out now. Let's see, launch poll. Yeah, so who currently considers equity a top priority in their community engagement efforts? So if you guys can see this poll, it looks like about 67 of us can vote. Go ahead and vote. And I'll leave the poll up for about 30 seconds, and then I'll share the results with everybody so you can see. Oh, this is so interesting. You guys, I know you can't see it until it's done, but I can see the numbers kind of flicking back and forth. It's very exciting. Okay, about 15 more seconds. Yeah, we've got about, okay, about half of people have voted by now. Okay, all right, last call. Get your votes in. Okay, I'm going to end the poll now and share the results. So now you can all see, look at that. That's amazing and interesting how there is like a considerable number of people and organizations making this a top priority. And then the number starts to bounce back up again around our organization is just starting to talk about it, which is also progress. That's really exciting. Okay, I'm going to stop sharing that now. This, by the way, this was my first successful poll sharing in a webinar, so that's pretty exciting for me. Okay, So next up, we have two phenomenal folks, and I can see their faces now, from Interior Health that we are so proud to know. So this is Katrina Leyenbauer and Katie Hunter. Katrina is a community health facilitator with Interior Health, and she's based out of Kelowna, and she works throughout the central Okanagan. And Katie is a community health facilitator who is based out of Nelson, and she kind of works in the central Kootenay and Kootenay boundary area. So they're going to be spending about 15 minutes with us here exploring the links between equitable consultation and well-being and healthy communities, other benefits to local governments that they might realize through more equitable consultation, and then some promising practices that they've seen in their region, because it's nice to have examples. So yeah, I will close my screen now, and I'll be happy for you to take it away.
Thanks, Jo. Good morning, everyone. At least it's morning where I am still, just before noon. So while Katie is getting our slides up, we would just like to recognize that within Interior Health Region, there's 7 diverse nations and 54 distinct communities. And Katie is presenting within the converging ancestral, traditional, and unceded territory of the Syilx, Ktunaxa, Secwepemc, and Sinixt nations, and I'm located on the Syilx Nation. And as part of our program, we really recognize that Aboriginal communities and people face many and disproportionately more inequities than settlers. And the conversation we're having today is really important in light of the Truth and Reconciliation calls to action and how we can create communities inclusive of all. All right, so we know that about 60% of our overall health is determined by social and environmental factors that Claire described earlier on. So where you live, how much money you make, and what educational opportunities you have access to are more influential than the healthcare system or even our lifestyle choices. So these factors affect the rates of chronic disease and injury, contributing to health inequity or unfair differences in health and well-being for people of different groups. So as an example, research has shown that the lower a person's socioeconomic position, the higher his or her risk of poor health. And to address the diversity of factors that influence our health, we require collaboration across all sectors and also within sectors. So the responsibility of health belongs to health authorities, local governments, social service agencies, businesses, and many more. And speaking specifically to local governments, they influence health in so many ways, as local governments are integral to the physical and social infrastructure within a community. I'm sure you can see some of your work of your community reflected in many of these circles. But do you know these circles aren't exhaustive, but can give you an idea of how local governments can influence health. At Interior Health, Katie and I support the development of a health lens and all policies approach. So policies outside the healthcare system are positively impacting health. And then another similarity with all these portfolios is community engagement is common in all of these planning processes. So by completing community engagement, you will have community voices incorporated with professional expertise. So going to the content versus context experts, when you develop plans and strategies, both lenses are important and valuable for an effective outcome.
Thanks, Katrina. So getting into some of the benefits, ultimately equitable engagement does lead to healthy communities. So by taking the time to ensure a variety of voices are heard, planners and decision makers are able to better identify barriers to health that their community members are facing, as well as better leverage the existing community assets, strengths, and resources into their long-range planning processes. So there are really benefits to both the process and the outcome of equitable community engagement. And what I mean by this is that the actual engagement process can have the potential to form connections between people and resources in the community that might not otherwise be connecting in their everyday lives, which may help to reduce some of these barriers to health. And then in terms of the outcomes of equitable community engagement can lead to values and needs of all community members being reflected in those community plans, like I mentioned in the last slide, which does lead to healthy communities. I just want to check, can everyone hear me? Because I can't see the chat box anymore. So if no one speaks up, I'm going to assume all is well.
We can hear you, Katie.
Okay, thank you. Perfect. Okay, another important outcome of equitable engagement that should interest decision makers is the opportunity to have increased buy-in and support from the community, which is often known as social license. And this really means that whatever project you're working on is considerably more likely to be the target of protests, campaigns, or negative attention from impacted people if these people feel like they have been left out of the decision-making process. And the last thing you want is when you've worked really hard on a project to get it to the approval stage, then be in the process of putting recommendations before your council, is to have a group of upset community members show up and say they weren't adequately consulted. In situations like that, it's really hard for council or your committee to say yes to your project, because then they will look out of touch with their constituents. So really, the more comprehensive engagement we can have, the better support, the more buy-in, the better social license. Another outcome of equitable engagement is a more effective use of municipal resources and preventing costly mistakes. So for example, in one of our communities, a new crosswalk was installed near a local school. However, the students weren't fully engaged on where the location of that crosswalk should be. And because of this, the crosswalk was never used by the students, who continued to cross in their preferred, more convenient, and less safe locations. So though a crosswalk is not overly expensive, this example does point out to how inadequate engagement can lead to some more costly mistakes. Lastly, equitable engagement can lead to innovative opportunities for collaboration and resource sharing between organizations and individuals that might not be the usual suspects for local governments to work with. So though our health authority can operates a little bit differently than other health authorities across the province, we all do things in a way that meets our community's needs a little differently. But from our perspective, we can support equitable engagement processes by participating as part of an engagement planning team, helping to connect people with hard to reach populations. So this might be seniors or people living with mental health issues, and helping to assist identify those barriers to health, as well as the assets and resources that exist in the community. We can also help to highlight some of those key questions that Claire had mentioned regarding equitable engagement. So these questions are: who will benefit, who may be excluded from experiencing those benefits, and why might these people be excluded, which can really help staff and decision makers start to understand the root causes of inequities.
To end, Katie and I are going to share some examples of engagement within our community to highlight some best practices. So this example is from the City of Kelowna in its Journey Home plan. They included a lived experience circle as a major part of their community engagement strategy. Starting as a group of 8 in the first session, the circle grew to over 100 members by later sessions, and over the duration of the engagement included 180 unique voices with 287 total visits. Their experiences of discrimination, the effects that stigma has had on them, and their ongoing challenges to navigate and access a complex system of services has been imprinted throughout the Journey Home strategy. So this is an example that really reflects those of including those that will be most impacted by the strategy and including the context experts and creating a table together. The next example is with the City of Kamloops. Planning staff met with grade 10 students for 3 sessions at a senior secondary school to discuss the OCP and to participate in a youth storytelling activity. The students developed surveys with questions related to the OCP's 10 topic areas and circulated them through social media to hundreds of other youth. Using key themes from their gathered responses, students then developed stories and skits that showcase their future vision for Kamloops regarding transportation, parks, recreation, and much more. The students then performed their stories and skits to city staff, teachers, and students from a local elementary school.
So as part of the wellness strategy, the District of Sicamous actually worked with grade 4 to 6 students at their local elementary. The students had the opportunity to answer the question, if I were the mayor of Sicamous, what would I do to make the community better for families? And though some of the answers were a little more whimsical, like flying cars and huge water slides and castles made of real gold, the students identified key determinants of health such as transportation, job opportunities, and housing. All the murals were then displayed in the district office and received a lot of attention from community members as they were strategically put up when the community had to go in to pay their property taxes throughout the month of June. So the value involving youth in this project and in the Kamloops example go beyond just gathering their feedback, but it's also an opportunity to show the youth that their perspectives are valued and the importance of participating in community processes and being an active citizen, which we all know are some important building blocks to healthy communities. Another example I wanted to share is an example of this tool here that can be used to engage community through online platforms, and the tool is called Thought Exchange. So Thought Exchange allows community members to provide feedback and then rate and upvote each other's ideas. So not only does this help local government staff to summarize community feedback, because it's kind of done for you, it also can be used in conjunction with other engagement tools to help reach people who wouldn't typically come out to a town hall or open house style event. So the City of Nelson recently trialed this platform to engage with the community around water conservation, but they're going to continue to use it this fall as part of their update for their active transportation plan. And the last example I want to share is one I was recently part of. It was the mobility audit to support age-friendly planning in the village of Midway. And so our audit group was examining the accessibility, ease, and safety of moving around the community, mostly for seniors. And to do this, we recruited one member of our group who used an electric scooter to get around. And I was really astounded at how she was able to identify mobility challenges that the rest of the group who were traveling by foot would have never been able to identify, such as a crack in a curb or a narrow sidewalk with a handrail that really prevented her to get to key community amenities. This example here is an example of how she was actually unable to get to the pharmacy and post office because of a deteriorating curb. So in addition, we also learned through recruiting group members to participate in the audit that a couple of community members who also use scooters would not be able to participate due to a lack of accessible washrooms in the community. They couldn't be away from their home for the duration of the audit without being able to get to a washroom. And this was really another key learning that we might not have been able to identify if we hadn't reached out and spoken to these people. So that's all for us, but we have our contact information up here, and please don't hesitate to contact us if you want any more information about any of those examples or just about our work in general. I'm gonna stop sharing now, and I'll send it back to you.
Thank you, Katrina and Katie. And I am just going to launch a poll now about the social determinants of health. So the question is, how much do you consider the social determinants of health when you're planning your engagement work? So let's see, we'll leave that up for about 30 seconds. And while we're doing that, I just want to remind people that there is the question and answer box at the bottom of the screen. So if any questions for you have come up that you want us to address at the end of the presentation, just go ahead and pop them in there. And again, you can do it anonymously. And we see some results coming in now. I'm going to leave it open for about 30 more seconds. Yeah. Let's see. Interesting. Okay. I cannot do both at the same time. Trying to share my nice screen and do the poll at the same time, but I can't quite do that, but that's fine. All right, about 10 more seconds. Get your votes in. All right, let's end that poll. And I will share the results. Well, that's really promising. So about 38% of us considering the social determinants often when planning our engagement work, very often. Yeah, okay. I love these polls. It's just a nice little opportunity to take a little breath and connect with everybody out there who is watching. So I now am going to introduce our final speaker today. And this is, there he is. Hi, Patrick.
Good morning.
So I first got to know Patrick because I was writing a community story about this very social sustainability engagement process that Patrick is going to be talking about, because they received a Plan H grant. So we supported them with a little bit of funding. And my impression of the township of Langley before this was like a slightly sleepy place. My aunt and uncle live there, and then I talked to this man, Patrick, and he just blew me out of the water. I was writing so fast, trying to get quotes for this story. So we're just we're continuing to learn from Patrick, and I thought it'd be great to have him here. So as you may have gleaned then, he is a strategic and social planner for the Township of Langley. He leads their social planning portfolio, and he assists with various community planning projects, including developing social policy and action plans, and collaborating with different departments and on initiatives that enhance community well-being. So Patrick, I will leave it to you.
Yeah, thanks, Joanna. Thanks for that introduction. Good morning, everyone. I'm speaking today from the Township of Langley, which is on the traditional and unceded territories of the Katzie, Kwantlen, Matsqui, and Semiahmoo First Nations. And I'm happy to share a little bit about the work that we've done so far on our social sustainability strategy. Looks like we've got a lot of expertise already on the webinar here, so hopefully you can glean something of interest. Before I get into it, I thought it might be helpful for the overall presentation just to share a little bit about the township, because it provides some context for those of you that might not know anything about where or what we are. As you can see on this slide here, we're in Metro Vancouver, just on the eastern edge. And we are not there. The township and the city of Langley are actually separate, unique local governments. It's kind of a funny story on why that is. Back in 1955, the residents of what is now the city wanted streetlights in their downtown core, which was urbanizing, and the rest of the township was not at the time. And the township council of the day refused to put in streetlights, so they divorced us. And I guess the irony now is that we've got 4 times the urban population of the city of Langley and probably thousands more streetlights than them. But that's history. As you may have noticed on the last slide there, we are a fairly large municipality in terms of our land area, second only to the city of Surrey in Metro Vancouver. And I think like many other large municipalities, we do consider ourselves a community of communities. We've got 6 unique urban areas, and truly each of those communities on the map there is quite different, has its own characteristics. And then sort of right in the middle of the municipality, all the way out to the eastern edge, with the exception of the Aldergrove area, it's our rural area. 75% of the Township of Langley is still in the agricultural land reserve. So that's also a very unique feature of the Township of Langley as well. What are kind of the key sort of trends and things that we're seeing here and experiencing in our local community? Well, we're rapidly growing in terms of our population. In fact, we're the fastest growing municipality in Metro Vancouver based on percentage growth. And this population is happening. This population growth is happening in areas that are currently, semi-rural or suburban, sort of like the picture in the slide on this background here. And so we're quickly developing into areas that look more like this, quite urban for sort of what was as Joanna said, a sleepy municipality. Some of the other trends that we're noticing and experiencing, like many other municipalities across the province, is we are having an increasing aging of the profile of our profile. But at the same time, we have a relatively high proportion of children still, so that's something that we recognize as well. And then we're seeing increasing cultural diversity. Our visible minority population is quite small compared to the rest of the region, but it's rapidly growing, as is our urban Indigenous population. And with these trends, we're experiencing and starting to see new perspectives and new opportunities in our community, but we're also grappling, like many other municipalities, with new social issues which are becoming increasingly complex. So, why develop a social sustainability strategy? It's really about trying to proactively address some of those social issues and trends that I had spoken to. It's an opportunity for us to set priorities and to lay the groundwork for action on social issues. We see it as a way to help to implement our higher level social sustainability, our sustainability charter and some of the goals and objectives in that higher level charter. And then it's also something that was articulated in our official community plan. And that policy in the official community plan that spoke to the social sustainability plan actually said that in that plan we should consider the issues of equity and inclusion. So it really made sense that we would aim to diversify community participation as we prepare that strategy. The other reason why we're taking an equitable approach to our engagement as part of the process to prepare this strategy is that back in 2016, the township prepared a comprehensive public engagement strategy. And that document was in response to a process that preceded it that didn't go very well. So the engagement strategy has a series of goals and various strategies associated with it in order to essentially improve our engagement practices. And one of them is really about diversifying who participates through these processes. And the terms of reference for the project that we're working on right now, so the terms of reference to prepare this strategy kind of articulate three key strategies that we're going to use and have been using to diversify participation. The first is that we're providing a variety of formats, so both online and face-to-face, different ways for people to participate. We're also going to the people, not expecting people to come to us, but we're going to where they meet into their communities throughout the township of Langley. And then we've also identified various subpopulation groups and we're targeting our engagement process to engage with them more effectively. Just as a really quick sidebar, there's a couple of other engagement principles that were articulated in our engagement charter that we're implementing through our process to prepare the strategy as well. And the first is really to provide early, ongoing, and meaningful engagement opportunities. And basically for us, that means operating on the higher levels of the engagement continuum. And the second is around accountability, transparency, and responsiveness. And Claire certainly spoke to this. When we ask for input, we take the time to record it, we take the time to analyze it, and we take the time to, publicly summarize it and then provide all of the data that we've received fully transcribed. So we're perfectly as transparent as possible through those processes. It also means making it very clear how that input will be used. I think with many other processes, you'll find that it's going to be shaped by existing policy or best practice research. So we're very clear with the public and our stakeholders that, you're one input into this strategy, you're certainly going to have your voice and you're shaping it, but you're not the only input into it. And then finally, as a principle, we always try to make it clear what decisions have already been made. So I can think of some of our ongoing neighborhood planning processes. You know, the decision to redevelop those neighborhoods has already been made through higher level OCP documents. Right now, the engagement process is not about, you know, if this area should be developed, it's how this area should be developed in the future. So back to the engagement process for our social sustainability strategy. As you can see, the overall on this slide here, the overall project is broken down into 4 phases, with the 5th phase being the implementation phase. And in phase 1, we started by retaining a consultant. We retained Modus Planning, Design, and Engagement with assistance from Strandberg Consulting and Solstice Sustainability Works. And they really helped us get the ball rolling on our equitable engagement. So we started in phase 1 by preparing a best practice guide on how to engage what we term sort of seldom heard from groups. And we kind of did this in several different steps just to be a little bit more cost effective with the consultant's time. So first, the consultant did a lot of research and identified different groups that are often sort of excluded from public engagement processes. And then staff scoped that list a little bit based on sort of our recent successes engaging those groups, and also some demographic information that we had for our township as well. And then they put together a scoped best practice guide on how to sort of target those identified groups. And they reported on the typical challenges that are faced by those populations. They put together a brief list of, you know, techniques, practical strategies for engaging those groups, and then also a brief list of effective tools, so different types of activities that could be used for engaging those populations. And then the consultant undertook sort of a formal engagement plan, looking at all the different phases, what questions would be asked, and what sort of tactics we would use to go about undertaking the engagement. And then one of the sort of next outcomes of that engagement plan was, you know, to develop a stakeholder inventory. So we developed a list of, you know, 75 to 100 stakeholder groups within our community that we wanted to make sure were being proactively invited, as they represented a number of the different clients and subpopulations that we wanted to hear from through this process. So in phase 2, we launched into our first round of engagement, and we did a number of activities in this phase. We kicked off with a panel discussion that was really a way for us, sort of actually being new, quite honestly, to social sustainability and social planning, to better understand, you know, from an academic sort of perspective and conceptual perspective, what social sustainability is. And then we held meetings with our project task force. We did some youth workshops, and we partnered specifically with the Langley School District, and we met with their social justice tables and their leadership tables. We did an online survey, and we incentivized that with passes to our rec center through a prize draw, so that had a good response. We also did you know, pop-ups in all of our communities, including our rural area, where we engaged with people sort of doing their shopping or visiting community centers. We held some workshops that were targeted probably towards more so towards stakeholder groups. And then we also did what we called thriving TOL conversations. And these are, you know, I think a lot of the term more appropriately used is, or more often used rather, is these kitchen table conversations. So we developed essentially an event plan, a workbook for members of our task force, other project champions, to undertake conversations with their networks. So we had, you know, people on our task force doing conversations with their neighbors and that sort of thing, but we also really had some great engagement with those seldom heard from groups. So we had some settlement workers do some discussions in Mandarin with newcomers in Langley, which we as a local government just don't have the capacity to do right now. We had our Langley Children's Committee do conversations with kids. And we also had some of our other nonprofit associations you know, do some roundtable discussions with, you know, people experiencing homelessness. So that was probably the most important tactic for really hearing directly from those groups. And it wasn't even township staff that were doing it. We really sort of empowered others to do that. And we had a great response. So that was a really successful approach. Between phases 2 and 3 of our engagement process, we really took the time to evaluate the successes and challenges that we had in phase 2. So through all of the engagement work that we had done in the earlier phase, we tried to sort of collect demographic information and just get a general sense of who's being engaged and who's not being engaged. And we identified 3 sort of main groups out of this that had not been engaged in the earlier phase. Those were our rural residents, local First Nations, and local businesses, actually. So moving into phase 3, we developed some engagement activities that specifically targeted those groups. So yeah, as you can see here, in phase 3, we did some conversations with our rural community in a coffee shop in the rural area. We invited people to come have coffee and cake with us and just basically chat about the issues that impact their quality of life. We did some more direct engagement with our local First Nations. We held a business roundtable in partnership with our local Chamber of Commerce. We did a social innovation lab that targeted a number of local businesses as well. We did a large youth workshop, and a lot of these activities in phase 3, by the way, were funded through that Plan H grant. So thanks to them. And we did some more task force meetings and some more stakeholder workshops. So a lot more engagement in this phase as well. On reflection, I'm not sure that any one of these items is any one of these tactics or things that we did is overly innovative. And I've said this before, I think what kind of makes our project, robust and equitable is that we kind of did a lot of these things. We did a lot of the work. So here are some of the lessons that we feel that we've, learned. I wouldn't call them words of advice or wisdom or anything, but these are just our lessons learned. When starting off an engagement process, take the time to do the planning. Think about who you want to engage and develop those tactics to directly target those groups. And also, in your terms of reference, try to provide as much flexibility as possible. I know sometimes councils will want to see exactly what staff will be doing. But if you can build in that flexibility to provide you that opportunity to sort of, develop new tactics and new activities in response to shortcomings in earlier phases of the engagement, I think that's really key. Our second is really to, around relationships and leveraging those relationships that you have in the community. We certainly couldn't have done the work that we did without, building and solidifying relationships with a number of community partners. And think outside the box a little bit. We're doing a social strategy, but we really wanted to engage local businesses. So we worked with the Chamber of Commerce and our BIAs. So, think outside the box on who those partners might be as well. The third point here is that obviously this took a lot of effort, and as a result can cost more money. I'm not going to dwell on that. It sort of is the reality, but it has many benefits. Katie sort of spoke to what those benefits are. Beyond just better decision making, it actually helped to build relationships among other community partners. We had people leaving our engagement events, with stronger networks on how to move forward on different issues, and allowing community members to hear the perspectives of others, particularly those seldom heard from groups that face those systemic barriers, was really important. And they walked out just feeling enlightened as well. And then ultimately it helped I think it really helped to build the community capacity to advance our collective efforts on a number of these social issues. And then finally, take some time to celebrate your success, like we're doing right now, I guess. And also at the end of the project, seek those opportunities for improvement. So for us, one of our real lessons learned throughout this was that staff are, at least I can speak for myself, we're not very well equipped to work and engage effectively with our local First Nations. So we'll be looking at, maybe building in some training as an outcome of our social sustainability strategy so that we can even improve our efforts next time. And that's my contact. If you've got any feedback, criticisms, questions, I'm happy to chat offline. Thanks.
Thank you, Patrick. Yes, we're here to criticize you. No, I think what's so great about this kind of topic is, equity really brings us around to the fact that none of us has all the answers, and it's really great to learn from one another as we try to move forward. But thank you. I love hearing about that example. And if anybody would like to read kind of the story about that, if you go to planh.ca on the front page, it's in the carousel. There is our community story about the social sustainability strategy engagement process that Patrick was talking about. So that's there. I'm just going to launch our last poll as we're wrapping up. Here we go. Poll number 3. So the question is, which of the following steps toward equitable engagement are you already doing or planning to do in the future? Okay. So hopefully everybody can see the poll. Oh, there, now we've got votes. Excellent. And I see in the chat box here, Sharito has made a great suggestion for a future webinar about the history of planning and how that has created inequities, and how that section that was mentioned at the beginning of the presentation. We love talking about that stuff. We talk about it a lot internally. So stay tuned. That could be a possibility. Okay, we'll just leave about 15 more seconds for people to participate in this poll. All right, I'm going to close the poll now, and I'm going to share the results with you. Okay, this is great. And if you, you know, you don't have to be very savvy to know that this was kind of a sneaky prompt that I'm giving you about which steps you could use when you are planning to do engagement in the future. So looks like 64% applying an equity lens when planning our next engagement strategy, 45% looking to other communities for leading practices, 64% discussing equity in community engagement with my organization or department, 39% considering the social determinants of health or proportionate universalism in planning community engagement, 30% shifting to the mindset of context experts. And Glennis is offering her other for the poll is to collect data about inequity in our community. Yeah, data, yeah. And Terry has offered us a resource that they say that every planner should read in the chat. Thanks. Okay, let's move to questions now. And I'm going to stop sharing this poll. Okay, I'm just going to click up the questions. So our first question here is for Patrick, and I see he's already answered it in the chat. This was Andrea asking, how much money did the Township of Langley spend on their engagement process? And so, Patrick, do you want to come back on and verbally give that answer? Because all the questions are for you. See if we can get Patrick back. I hear him. We'll see him in a second.
Trying.
Yeah.
Oh, you stopped me from doing video, apparently.
Oh. Well,
that's okay. I can start to talk. So the
you talk.
How much money did we spend? So I just noted in the chat that I would estimate probably consultant costs, room rentals, incentives, all that sort of stuff was about $30,000. And I just noted that our consultants did a lot of the planning and strategic thinking with us. So what I mean by that is they did the best practice guide, the engagement plan with our input, and then we sort of co-developed the event plans and co-developed the online survey, but staff really did the legwork in operationalizing it. So we were the ones at the pop-ups, we were the ones facilitating all the workshops. It was the community that was facilitating a lot of those kitchen tables pieces. So I think roughly about $30,000, and our total project budget was about $75,000. So hopefully that's helpful. The demographic question. So yeah, I can send that out to you. We generally sort of used how Census asked their questions just to try to be as consistent as possible. The only sort of lesson kind of around the gender question is we just left it open-ended. And I think that's probably best practice now in online surveys, just to keep that question open-ended. And there was one other one, isn't there, Joanna?
Yes. How much of a challenge, this is from Daniel, how much of a challenge did you have initially when you were starting that social sustainability practice in terms of pushback from multiple stakeholders, council? How did that go?
So you know, it's an interesting time here for the township because I'm actually like the first staff person in this social planning portfolio. So it was something that the community had honestly been advocating for like 25 years. So when we finally got it, there was this like great buzz around it, and it's like, oh, we're doing all this great work. So I really sort of jumped on that momentum early on to get going on this strategy. And as I'd mentioned, it was something that was articulated in policy as something to consider on an official community plan. So we kind of had like a great opportunity with both all that community momentum and I think council momentum as well, and plus that policy in our OCP to undertake that work. You know, where I thought we were really going to get into sort of hot water with our strategy is that, you know, unlike some of the other municipalities that have done these social plans that kind of consider like, you know, almost like I'd say all of the issues under the sun, like you'll, you know, and that's great. Some of them have really significant resources and able to do that. We're leading in a direction with our strategy that is a little bit more around priorities. So we're actually only identifying, you know, 6 issues of the, you know, plethora of things that could be explored that we see as kind of the priority issues that will address our current, you know, challenges, but also the emerging trends. And I was really nervous about that because, as you can appreciate, you know, stakeholder groups that have maybe a specific interest in a specific issue or population group might feel like they're being excluded. But so far we've just had a really great reception to sort of that. And I think people kind of get that as a smaller municipality, we have, you know, somewhat constrained resources and we can't do everything. And our strategy, I think, will ultimately be more transparent at the end of the day if we are a little bit more strategic in our approach. I don't know if that answers the question. Hopefully it does.
So yeah, those were our 3 questions that we had in our question and answer box. Does anybody actually, while I'm doing kind of a last call for questions, Patrick, I had a question for you. Mm-hmm. I always like the what was the first thing or what's one thing, which I know is not always fun to answer, but you know, if you when you do this again, when you're maybe like in a different position or with a different community or however your career goes, if you were to do this again, like what is one thing that you definitely would do differently?
Oh.
If you can say.
Yeah, I think we'd want to do a little bit more. Like I think we'd want to invest just a little bit more resources and time. Like when we did, for instance, those rural community conversations, I think we ended up having, you know, maybe 30 plus participants or so over the course of 4 sessions. And that would have been great to do more because there's, you know, 25,000 residents in our rural area. Like any sort of qualitative research, you do get to a bit of a point of saturation where you start to hear the same things over and over again. So we were, I think, comforted, and I think we did reach that point in those focused discussions. But yeah, the opportunity to, you know, host those rural community conversations, not just in a central location or rural area, but in those little smaller hamlets within our rural area would have been great to do as well. And we learned a lot from the pop-ups. We didn't do a great job with those. At the end of the day, sort of on reflection, we didn't have a lot of great input coming out of from that. People that took a survey card didn't end up doing the survey because we asked how you heard about the survey. And I think our locations were just not the best. We did them at sort of shopping centers and community centers where people were, you know, coming and going. And it was tough to engage them. I think for those pop-ups to be successful, you need to really piggyback on sort of like an event, like a farmer's market or a, you know, community festival where people are there to stay and look at booths and, you know, have the time to engage with you. Yeah, so those are some of the other kind of lessons learned, I guess.
Okay, and I don't see any other questions popping up in the question box. So maybe that's it, and that's great because we are just about 9 minutes out from our official webinar end time. So I guess I just want to say thank you so much to everybody who joined us. Again, you know, one of the great things about talking about equity is just being able to admit that nobody has all the answers and we're all figuring this out together and learning together. And I want to continue to encourage you to learn together. And so we're going to send out an email after this webinar is done with a copy of the recording once it goes up on YouTube, all the slides. and we're going to send the contact information for our various presenters in case you want to get in touch with them and chat and learn more. You can also add to the conversation over on Twitter with hashtag equitable engagement. We got quite a few tweets so far. And again, if you haven't yet downloaded our community engagement action guide, you can go to planh.ca/engagement guide and get a copy of that there. And we'll also be printing them. And if any of you are going to be at UBCM later this month, we will be there too, and we will have hard copies there. Oh, and one more thing. You may have noticed our slides at the beginning, they looked a little bit different than you're used to seeing BC Healthy Communities look. That was a little sneak preview of our new brand, which we're going to be rolling out in the next month. And our official brand debut is at UBCM. So we're really excited. Any of you who are attending UBCM, if you want to come on by, see our new look, you can definitely get in touch with Claire if you want to schedule a formal chat and a sit down to talk about potential ideas you have for grants in the future for your community. And yeah, we're really excited to see you guys. Thank you so much. I see some people are signing off now, and that's excellent. I'm going to leave the chat open a little bit longer so that people can copy any links that they need. But for now, we're going to sign off. So thanks again, and I hope you join us next time.